Welcome to our conference session titled Living Well with Bone Marrow Failure Disease. Thank you for joining us today. My name is Lee Clark, Director of Patient Services. Before we get started, I'd like to recognize the generosity of our corporate sponsors and the generous support from our patients, families, and caregivers for supporting the conference today. Immediately following the presentation, there will be a question and answer session. If you are participating online, please feel free to submit your questions at any time during the presentation using the Q&A icon in the engagement panel on your right. To submit your question or comment, type your question in the Q&A text box window and just hit enter when you're done typing. We'll do our best to get to everyone's questions today. We will be going back and forth between questions online and questions from those participating in person today. When asking questions, I do ask that you do two things to help me manage the incoming questions. Please submit your entire question all at the same time if you're online, and please do not share private health information in your question. Our expert speaker cannot answer any specific questions related to your health care. Our specialist today is Megan Pailler. Dr. Pailler is an Associate Professor of Oncology in the Department of Psychology. In 1999, she earned her Master's in Applied Child Development. In 2004, a Master's in Clinical Psychology, and in 2004, PhD in Clinical Psychology. She provides clinical assessments and intervention services to oncology patients, both inpatient and outpatient basis. Her area of focus has been the hematological services, including leukemia, lymphomas, and bone marrow transplant, providing intervention for patients throughout the spectrum of transplant as an integrated member of the treatment team. It's my pleasure to welcome Dr. Pailler. Thank you so much for joining us today.
Good afternoon, everybody. I think I'm far enough socially distanced that I can take off my mask and be okay. That way people can at least see a facial expression. Let me get the lay of the land here. Okay. So this was an interesting talk to try to organize because there can be such a spectrum among folks with bone marrow failure. I hate to even use the word failure in a in a diagnosis, but folks with MDS, aplastic anemia, there can be such a range. So I'm trying to gauge it across the spectrum, but if you have specific questions or want more tailored information, we're going to have some time at the end. So obviously the psychological impact of any diagnosis can be huge, and we can see our little friend here who's reeling and often not sure what to do. So one of the things I think that can be particularly challenging about diagnoses such as MDS, aplastic anemia, is that there's not really a forum or an easily accessed forum among our community as far as what that means. So everybody, you know, in October, everybody has the pink ribbons for breast cancer awareness. People usually know somebody who has had a diagnosis like that. With something like MDS or aplastic anemia, you're likely to get a whole lot more questions or uncertainty as you try, first of all, to internalize what that means for yourself, and then also, how do I explain this to others? I think the other thing that can be challenging is that the course of treatment can be variable from something that's low risk that requires some sort of maintenance treatment to something as invasive as a bone marrow transplant. So oftentimes it's a challenge if you don't necessarily know what you're dealing with and what the course of treatment or the time frame of treatment is going to look like. I think also if the treatment doesn't have a real clear beginning, middle, and end, from a coping perspective, that's much more challenging. You can say something like, okay, well, I have 6 months of treatment, and then I'll be able to be done and go ring that bell. I think it's a lot more difficult of a situation if it isn't that clear, or if treatments are going to be something that are going to have to continue for the remainder of your life sometimes, and it's a harder thing to wrap your mind around at times. The other thing that I spend a whole lot of time talking to people about is identity. Obviously there's a lot of different components of our identity. You can be a parent, or you could be a spouse, you can be somebody that's good at sports, you could be a caregiver for others. There's a lot of different components of identity, but I find that illness often, it can really throw a wrench in how people see themselves. I hear stories a lot about, well, I really identified with my career and I was set on working to this date. Now that's changed and I don't have that sense of myself. Things like social functioning, obviously diseases that impact immune functioning, particularly in this day and age that we're living in now, can be very limiting. So social circles can look different. Some people used to provide care for their little grandchildren or, no longer able to do that because of immune functioning. Things like physical abilities, even appearance, sexuality, spirituality, those are all things that can be impacted by a diagnosis. With the overall theme of these were the things that made me feel like myself, and now I'm not quite sure what to do about that. I don't feel like myself anymore. I promise it gets more uplifting as I go. There's critical periods of adjustment too. I think times where things can shift can be more difficult. Obviously diagnosis, the diagnosis, what does this mean? All of a sudden my life is going to change course and go down a different path. I think that's probably one of the most critical periods for adjustment. But in addition to that, the beginning of treatment often comes with quite a bit of burden of, I've got to be here at a certain time, every week, every month, it's this many days. So adjusting to the demands of the treatment. Anytime disease status changes, if there's a transformation of disease or if the treatment approach is going to change, I think that's another period of adjustment. If one treatment stops working and you switch on to the next, I think psychologically it takes a minute to be able to adapt. Other things that can be stressful, it's often surprising, but the end of treatment or a transition to maintenance therapy, those transitions can be sort of unexpectedly stressful because people generally look forward to treatment being over, but that comes with its own host of challenges of, wow, I used to feel held and now I'm kind of on my own with it. I have to get the microphone just right so I'm not leaning into or away here. Bear with me. At any rate, these different transitions or critical periods are associated with different sorts of tasks as you work on adjustment. So in my world, oftentimes we talk about distress, and distress is a term that we use because it doesn't come with as much of the stigma as depression or things like that. And distress is defined as an unpleasant emotional experience of a psychological, emotional, or spiritual nature that may interfere with your ability to cope effectively with illness. And this little equation here, I think is helpful because distress in general, and this is not just illness-related distress, but any distress, you can often think of it as a fraction where you have your perceived demands, right? The things that take your resources, that take your time, whether it's illness, having to go do 16 different things, and then you divide that by your resources, right? The things that you have to manage all the demands that you have. So resources could be things like strength or energy level. It could be things like social support. It could be things like time. So in general, we tend to see that distress goes up if you've got too many demands and not enough resources. And I think that is something that everybody can identify with, that it's those two things that we can talk about, both as far as trying to reduce some demands, but also as far as trying to bolster the resources, both logistical resources and also coping resources. Okay, so this is just a continuum that we use sometimes, because a lot of times I get, oh, well, of course I'm depressed, I have cancer, of course I'm depressed, you know, this is going on, but not necessarily. I think there's a spectrum, right, of distress from normal feelings. I don't know anybody who gets a life-changing diagnosis and doesn't feel some level of distress. I mean, distress is kind of oftentimes part of the package. But there's a continuum from that sort of normal distress to the things that we call adjustment disorders, you know, where there are struggles that are maybe time-limited or specific to illness, all the way down the spectrum to folks who are really struggling with some pretty clinically significant either anxiety or depression. But I think the real take-home message here is that distress is on a continuum, and feeling sad, feeling anxiety, crying, these are all things that are normal. And I think there can be so much of an emphasis on positivity, which, you know, positivity is a wonderful thing. But I think it can sometimes be a challenge whereby everybody has an expectation on themselves that they feel positive and they approach this with positivity. And I think that's a wonderful thing when you are able to be positive. But I also think there can be it's almost like a trap where you start feeling guilty if you're not feeling positive enough. And I think it's just important to acknowledge that sometimes these, you know, these emotions, these distress emotions are, first of all, okay, and second of all, kind of part of the situation. It's just then the question becomes, what do you do about it, right? How do you manage it? Which is where we're going next. Okay, so probably the most important variable in determining how people cope with illness is the quality of their social support network. And social support means a variety of different things. It can be the people in your house, the people that, you know, in your immediate circle that can provide care and support, but also things like how many layers out in your community do you have to try to kind of hold you and help you through. Some advice that I've sort of gleaned over the years is a lot of times it can be difficult to accept help from other people, particularly if you're somebody who is used to being in a caregiving role. You know, you're the one who feels comfortable driving over and checking in on people and things like that, and it can be difficult when the situation is reversed. My biggest piece of advice is accept help. Sometimes people offer help, but they don't really know what to do, or they say anything you need, you know, things like that. One of the things that can be helpful is to provide those well-meaning people with actual, concrete suggestions about what can be helpful. So, for example, you know, we're really struggling with the meals. Or I don't know how to get my kid to soccer practice because I have to be, you know, doing this or that because of treatment schedule. If you can give people concrete suggestions, they love it because they want to help, but they don't know what to do. It is also absolutely okay to tell friends what is and is not helpful. A lot of times you don't want somebody coming to try to solve the problem. You know, there are very well-meaning friends who say, you know what you have to do? You have to do this supplement that my second cousin's friend did. It cured it. That's what you need to do, right? Like, thanks. There's all kinds of things. Or, you know, somebody once, I had a patient that I was working with who said she was visiting with a friend, and her friend said, you know, I can tell you don't have the bad kind of cancer because you still have your hair. Okay. You know, things like that you hear from people who are really trying to help, or any sort of feedback that starts with at least. Well, at least it's not, or at least it isn't, you know, those things, I think, you know, people are trying to make you feel better, but it ends up not being helpful. At any rate, it is absolutely okay to give friends a nudge and say, you know what, sometimes what's helpful is if you just listen. The other thing that I think can happen is that you can get tired of telling your story and your medical updates to every single person that asks. So I think one of the things that can also be helpful is to develop a sort of a Cliff Notes version. You know, doing well, treatment's going okay, thanks so much for asking, tell me how you're doing. You know, two or three brief general statements and then a redirect. And a lot of times people feel like it's almost like you have to rehearse this so that you can get into a rhythm of it where you're not sort of sideswiped when you're at Wegmans trying to, you know, buy your food and somebody wants your whole medical history. So those are also things that can make it a little bit less uncomfortable when you're trying to interact with people who maybe aren't in those closer circles. So how do you maintain identity? This is the big one. It's tricky because a lot of times what happens is you lose access to those things that are important, or you lose the ability to engage. And I think trying to figure out some sort of way of maintaining connectedness with those key identity pieces, I think that's really important, because it can be the case that, you know, once your access to those things becomes limited, you may withdraw, right, or retreat from it. So it's always the case, I think, that doing a small amount, trying to figure out some sort of workaround, is better than the complete disengagement. I can think of a story of a man who used to take his dog for hikes, and he just loved being outside, he loved being with his dog, but he couldn't hike anymore. He wasn't physically up for it. And so he stopped doing it, and it was a loss, because, you know, he said his dog would look at him with that look, like, what are we doing, come on, you know? And he loved being outside, and he hadn't been. So in his case, it was about, okay, well, there's a park where I could go, there's a bench I can sit, I can bring the dog, and we can be there, and we can go to different places. I just can't do the same, you know, hiking loop that I used to. So it was a way of kind of approximating it, but not, you know, not being able to do exactly what you used to do. And it's like, that sort of stuff takes a whole lot of trial and error and a lot of flexibility. I think the other thing that can be helpful is to examine what we call the core values, right? What are the things that are really important and meaningful to you? For a lot of people, it has to do with connecting with loved ones. For some people, it has to do with maintaining some sort of intellectual curiosity or social network or whatever it is. Everybody, if we asked everybody in this room, everyone would have a little bit of a different story about what are the things that are really, truly important. And it's almost like those values, right? Those are the things, you can kind of think of it like the compass. It's not a goal necessarily, but it guides you. It points you into a direction of things that may be important to try to figure out keeping in your life. And my values and your values, they may be different, but that's why I think it's important to kind of think about what are the things that are most meaningful and most important to you. Obviously, self-care and nurturing are, it almost becomes buzzwords these days, but you can get yourself into a situation where you can kind of just get overwhelmed and not really think about, well, what do I need? What would make me feel good or cared for right now, particularly if things are stressful? Okay, activity pacing. A lot of times illness comes with fatigue. That's one of the biggies. And so not having the energy or the endurance to be able to do the things that you want to do. This is my, activity pacing is a whole approach, but I'm going to give speaking of Cliff Notes, I'm giving the Cliff Notes version here. It's a strategy to reduce the overactivity, underactivity cycle. So if you think about, you've got an event coming up, it's a family reunion, right? You want to go to the family reunion is important to you, so you're going to, and they're coming to your house, right? So you have to clean, and you have to do all of these different things, and so you work really, 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 really hard, you get it all done, and then you're down for the count for the next 3 days, because you've sort of overexerted, and then you pay the consequence. And so that's a cycle, I think, that happens for a lot of people, where you push it too much because you really want to get the thing done, and then you have to rest and take it easy, and then that's that underactivity, and then you can sort of get back to the point, but then you feel so badly because you've been sitting around for 3 days that you push it too far, and then you go, and it's a cycle. It's like a sine wave with a big amplitude. The key with activity pacing is trying to shorten the amplitude and do things in a way that doesn't sort of cause the crash afterwards. The analogy, and I don't know where I heard this. I think I probably heard this 15 years ago from somebody, and I held on to it because I like the analogy. She said it's kind of like you start the day with a certain number of spoons in your drawer. And anybody who has worked with me has heard this one, so I apologize if this is redundant for some people. But if you think about activities, right, there's a spoon cost for activities. So, for example, taking a shower in the morning might be 1 spoon or 2, and going out to lunch with a friend might take 3 spoons. And the problem is you have a finite number of spoons in your drawer. And if you get to 1 o'clock in the afternoon and the drawer is empty, you're kind of in a bind. So the key is, what are the activities that are spoon-worthy, right? What are the things that are important that I really want to do? And I had somebody say the other day that they were going to a concert, and so they saved their spoons for the day for the concert, right? They prioritized the thing that was going to give them the biggest, bang for their spoon buck as far as quality of life. A lot of times we spend time running around trying to do tasks, but it's helpful to take a step back and think about, well, what are the things that are really the most important to me, and how can I spend my spoons wisely? I think another thing is having realistic expectations. I think people have a tendency to create expectations for themselves based on their pre-illness self. So you think, well, I used to be able to do all these things and then still have energy to make dinner and then go for a walk after dinner. Well, and now that isn't the case. And so there's a tendency to kind of continually feel like you're underperforming or letting yourself down. I think it's a much more helpful approach to say, okay, well, this is where I am. This is where I'm starting, and I want to try to build up a little bit of endurance. But A, I know I have to do it slowly, and B, I have to judge myself based on where I'm starting from now, not based on where I was 3 years from now, 3 years ago. And I think it's a lot of this is just about flexibility and willingness to adapt, right? To try to say, like the man with the hiking, right? He could have said, no, I'm not going to do it. It's going to make me too sad. But he said, no, I'm going to give this a try because something is better than nothing, and it's going to improve my quality of life. Okay, some other things that tend to come up when we talk about fatigue. Sleep hygiene is an important one, and that can be tricky too. If you're struggling with fatigue and end up napping during the day, it can create a cycle where then nighttime sleep is more challenging. And I think a lot of times, if people are going to struggle with worry, we're getting to worry next, but if people are going to struggle with worry, it tends to be that middle of the night quiet hours that can be the hardest. So you can get into a cycle of disrupted day and night sleep. So obviously limiting naps is an important piece of that. And then the other thing that has come out of some research on circadian rhythms with people undergoing cancer treatment is the importance of the bright light exposure early in the day. They've actually done studies where they've given people light boxes, which have really helped sort of reset the circadian rhythms. But in the absence of a light box, you can approximate it by trying to get outside or get into a bright area. Usually around 9 o'clock in the morning, about a half an hour's worth is tremendously helpful as far as both giving the, helping with the fatigue and also maintaining some of those circadian rhythms. So this is, my preferred approach for managing anxiety. We'll talk about some others as well. So a lot of times, people struggle with illness-related anxiety, right? Especially, again, during those transition periods. And a lot of times what people do when they're unsure about what the medical picture is to go on the internet and look things up. And that's a tricky one because you want to be an informed consumer of your health, right, and of these different treatments. And obviously everybody in this room and online is coming to a symposium like this to try to educate themselves, and education is tremendously important. But there can be this tremendous rabbit hole of looking up things online, right, because it can suck you right in, and it can also lead you to places where the information may not be as current and as accurate. A lot of times I talk to people about the Goldilocks principle, right? Not too much, not too little, just right. It seems like the best gauge on that is that there are likely periods for information gathering where it's important to do some research, right? If you're trying to decide between two different treatment options, if your provider is giving you information on a clinical trial, things like that. Those are times where doing research can be helpful. The problem becomes when the research is used as a way to try to manage anxiety. And I think that happens a lot because when you get upset about something or you think, oh, what about this? Well, then you go to look it up, but then you look up something else, and then you read something about that, and then you're off to the races, right? And rarely is it the case that people tell me, wow, I did a bunch of research online and now I feel more relaxed. Doesn't usually work that way. It usually starts off well-meaning and with a purpose, and then you end up way somewhere different than that. The other thing that I have also heard is a lot of people are on different sort of MDS, Facebook groups and things like that. So you can be minding your own business in your life, and then bing, you get some alert. And then the alert sort of sucks you back into it. So another good piece of advice is do something to prevent those alerts from happening on your phone to limit the intrusiveness of it. We've done a whole lot of things about, giving yourself 10 minutes and no more, setting an alarm for getting yourself off. There's a lot of different strategies like that for regulating it, but I think the most important piece is that usually if you're out living your life, rather than being online doing research, that's a better choice. And excuse the excessive E on the metaphor. I don't know where that came from. But the shoebox metaphor is I like to talk to people about the illness-related content, right? The fears, the thinking about prognosis, the digging into the research. It's almost like you need a metaphorical shoebox, right, to be able to store that stuff so that it's not strewn about your life all the time. You need to have it. You need to access it at certain times, and then you need to be able to set it on the shelf. It's different than avoidance or denial. It's about having it over here next to you so that it's not obscuring your vision as you try to sort of go about your life. And then the opposite end of helping that is continued engagement in things that you enjoy doing. Other sorts of helpful strategies for managing anxiety and kind of health-related or otherwise are a regular practice of mindfulness and relaxation activities. And I know I am a very, very poor meditator. It's counterintuitive to how my mind works, and I have to really, really work at it. But when I do, it's tremendously helpful. It's one of those things that it's almost like any sort of weightlifting routine or anything like that. You don't go one or two times and then bask in your lovely muscle tone, right? It takes a whole lot of time to sort of build up the skill. And it's the same thing, I think, with mindfulness or daily relaxation practice, that it really is in the repetition of that there's benefit to be gained. A lot of those strategies involve sort of refocusing on the present. I have someone I work with who talks about how, that the train of worry about the future will come to the station and he has to choose not to get on at any given moment because then off he goes to the what ifs, So trying to stay focused on the present, I think, is one of the things that a regular mindfulness practice can do. Okay, that clock is making me nervous, but I think we're still okay. I'll choose to look at that one, which is still fast, but better. So there are the task of managing difficult thoughts and emotions is really sort of the psychologist's bread and butter, right, of what do we do when people come to see me. So this is my attempt at distilling, a lot of information into a capsule here, so bear with me. With thoughts and emotions, I think probably the first step is to just be able to stop and say, all right, I'm upset now, what's going on? Why do I feel upset? Am I scared? And do I feel guilty? What's the emotion that I'm having? And then are there thoughts that are driving that emotion? You can sort of think about thoughts as the intermediary between a situation that you're having and whatever your emotional experience is. Usually there's something in the middle there that is either amplifying it or not, right? That changes the way that you feel about any given situation. The classic example of that, if you think about giving a talk, for example, what might be, that's the situation, right? What might be the thoughts that would accompany that? Oh, this is exciting, I get to share things with a group, makes me feel good to be connected. Uh-oh, what if they don't like me? What if nobody comes? There's all different sorts of thoughts you can have, and then that really impacts how you feel about something, right? And you can go, if your thoughts tend toward, I can handle this, this is a situation that I can manage, the outcome is different than if you're overwhelmed, unable to handle things like that. So one of the approaches when we talk about thoughts is to really ask yourself, with any given thought that you're having, is this thought helpful to me, to my cause in this particular situation? And obviously with coping with illness and with coping with things that are very scary, we're not saying the thoughts aren't necessarily accurate, because they very well may be. But there are some thoughts that tend to be more helpful than others. Things like, I'm never going to be able to handle this. It's too much. The it's too much one, I think, is particularly hard, right? Because you can just snowball it right up. So with reframing, what we try to do is to say, is there a more balanced version of thinking about this situation that could be helpful, right? This is hard and I'm overwhelmed, but I have a plan. Or I'm going to bring my caregiver, my spouse, my loved one with me, and together we'll get through this. Things like that. So there are ways of trying to manage the thoughts in a way that can lead toward just feeling a little bit more like you can handle it, or that it's not quite as overwhelming. I had a person that I was talking to once about the prospect of coming in for transplant, and she said she was trying to switch her thinking because she was getting so angry with her doctors. Why do I have to do this? I don't want to do this. Why are you making me do this, right? And she said that was just causing this, almost like she's ready for the fight, but not in a good way. And it was about trying to shift it to, wow, they're really offering me the best chance here at some real quality of life or long-term survival. And it was the switch that then enabled her to sort of reframe how she was approaching the transplant, and it was very helpful to her. So sometimes you can work on trying to reframe things in a way, again, that's more helpful. The other approach is this idea of defusing from a thought. And what that means is trying to create a little bit of space between you and whatever the thoughts or the emotions are. And probably the best way to describe this is, if you're walking around, I know this is not an illness-related example, but if you're walking around and you're feeling like a failure, right? I'm a failure, I can't do anything right, oh no, right? On and on you go. I'm so stupid. You can step back and say, wow, I'm having a whole lot of thoughts about being a failure. You create a little bit of space between yourself and whatever those thoughts are. Like, oh my goodness, my anxiety is really, it's really ramping up today. I can feel it sitting there in the room. Again, it separates it from you. And then what happens then with a little bit of space, you don't have to quite fight with it as much. My favorite thing that anybody ever told me, which is a perfect example of this. I had a woman who was scared of relapsing, and she said she was working so hard to bar the door against these fears, right, of relapse. I can't think about it. I got to stop. And she said eventually her arms got tired, holding the door shut against all these negative thoughts. And what she decided to do was she decided to have a different approach where she said, you know what, I'm not going to stop them from coming in. But what I'm telling them, she's talking to her thoughts here, she's like, you know what, you can come in, make yourself a cup of coffee, I'm going to be over here doing my thing, put the dish in the sink and close the door on your way out. And that was her strategy for creating a little bit of separation, right? Because sometimes the thoughts they're so powerful, but to be able to say, wow, yep, those are those thoughts. For a lot of people, what we do is we manage, one of the exercises is, if your anxiety were a creature, what would it look like? And people's anxieties are all different sorts of shapes and sizes, but it can be a helpful thing to do, because then now it's over here, it's not kind of attached to you. So that's like about as brief as I can be with a description of what diffusion looks like, but the idea is to create some space, and also to be able to kind of watch the thoughts come and go. Again, that's this wave analogy, right? That if you think about your thoughts as waves don't really benefit from being stopped. You know, you can't necessarily erect the barricade. I mean, people have break walls, but in general, it's not so helpful of an approach to get a wave to go away. But if you think about thoughts as waves, what you know is they usually crash and they usually dissipate. So rather than, fighting with them, just kind of observing them and letting them go, if you think of the thoughts as waves and yourself as the ocean, you're going to be able to contain it. The ocean always contains the waves. They ebb and flow. And so sometimes it can be a helpful sort of analogy for managing those intense negative thoughts. Okay, I'm going to shift gears a little bit to talk about the impact of illness on the family and the caregiver system. I would be remiss in a talk like this not to acknowledge that illness affects the whole family. And there are whole family changes that happen with a diagnosis. And those changes can be all different sorts of things. But in general, we can see things like changes in role functioning. I have a lot of people who really, really hate relinquishing control of cutting the grass. They always used to be the one to do it, and now their spouse is doing it, and it's difficult, right, to change that. Changes in relationship dynamics. I see a lot of this after bone marrow transplant, because the caregivers are basically told to keep track of things and to make sure that people take their medicines and do things like that. And you can imagine what that would do to a marriage. All of a sudden, it's not necessarily a partnership, and it becomes almost parental in some sort of way. And then people get resentful, and they, not that people are acting out, but there's a little bit of a dynamic of, please stop telling me what to do all the time. So there could be changes in relationship dynamics. Loss of intimacy and physical closeness can be a consequence of illness, which is not often, people don't usually ask questions like that in the context of routine care, but it can be a major source of stress for some people. Caregivers a lot of times have significant stress and distress, but there's an expectation that I shouldn't be talking about this because I'm not the patient and I'm not the one, I need to keep it together. And then the patient will say, well, I don't want to complain because I need to keep it together. And then everybody's really vibrating with distress, but not talking about it because they don't want to burden the other one. Things like that. I think that, these are things that can be important to talk about, because a lot of times the sharing of the emotions of how this feels like tends to make people feel better rather than worse. So one of the challenges, which I alluded to earlier, is the idea of coping with something that is chronic, right? Coping with, if you say, okay, I've got 6 treatments to do, okay, I can do that. Then I'm halfway done, woohoo, right, and then I can ring the bell, woohoo. But I know people who can never ring the bell. It's not a kind of an illness where there's a bell to be rung. And then what do you do? Then how do you figure out ways of coping with that? And I think one of the things that can be helpful is to try to create other different sorts of milestones, right? If the treatment isn't providing the milestones, then that's something that can come from somewhere else. So I've got the fall coming up. I'm going to do this activity on this day. Then I've got my treatment, so I know I'm going to be kind of down for this particular thing. And then my plans for Thanksgiving are as follows, right? So you can kind of create some structure with some planning around enjoyable activities or other benchmarks, so-and-so's wedding or, things that are important for you. And finding those other milestones or ways of making progress, even if it's goal setting. I spent some time talking to somebody about putting baseboards in her kitchen the other day because she just had so much time. She's on maintenance therapy. She has all this time, so why is she going to do it? Because she could do it tomorrow, but then tomorrow comes and she doesn't do it then because you don't have structure. It's the lack of structure, I think, that can be challenging. So then the task involves trying to create some structure, some routines and things like that. The overall focus is on, and again, I know it's much easier said than done, but it's on minimizing the burden of treatment, if there is a way to do that, and maximizing quality of life. So when to seek help? Reasons for referral to a psychologist, if you feel like you are interested in talking to a psychologist, that would be one reason, but in general, we look for, obviously distress comes and goes and is part of the territory at times, but if you're having persistent distress that lasts nearly every day, greater than 2 weeks, and interferes with your ability to function, those are really the 2 criteria for, okay, maybe I need to do something about this and get some help. Things like changes in, like real significant changes in your attention or concentration or mood, anxiety level. Obviously any thoughts of suicide or self-harm is a red flag. Changes where you're struggling with body image, things like that, that's another kind of thing I talk to people about a lot. Difficulty adhering to treatment, that's another thing. I think, I just talked to somebody the other day who said, you know what, I don't know what the point is of this. I'm thinking about not doing it anymore, right? Because it gets to a point where there's a burden there. Those are the situations where if those things are going on, then it may be time to say, well, let me reach out here because there are support resources available. And these are the indicators of when it would more sort of clearly cross the threshold. It's, again, easier said than done. The stigma associated with coming to see the psychologist, it's much, much less than it used to be. And I think with COVID, it's even less than it was 3 years ago. But, I'm not crazy. I don't know. I've never done this before. What is she going to do? Am I going to have to lie on a couch? All those types of things. There can be some reluctance in accepting outside support or feelings of shame in being seen as weak or dependent. And then I think the reality is in the hierarchy of needs here, oftentimes your medical needs come first. And if you're already overburdened and going to 7,000 appointments to go to 7,001 to talk about your distress about the 7,000 appointments can seem like the cost-benefit may not win, which is interesting now that we're offering some virtual visits. There definitely are other options, but I think it can be hard, particularly if somebody isn't feeling well, to come all the way out for an appointment. So in conclusion, I think I like to think in terms of adjustment, right? Adjustment is a process, it's not an event. And it changes over time as your illness changes, as your circumstance change, And it's a moving target, right? But always, how am I going to adapt and then be able to move forward, right? Because that's really the goal. Successful adjustment involves being able to manage, again, not stop emotional distress, setting realistic expectations for yourself, of yourself, staying active in the activities that are meaningful and important to you, and trying as much as possible to retain key aspects of your identity. And then the obvious final message is that help is available if you need it. So thank you, everybody. And I will answer some questions if people have questions. I'm going to try to figure out how the mic works.
Oh, thank you so much. Do we have any questions from in the room? If not, I can go right online. Okay, great. Thank you so much. Our first question comes from the spouse of an aplastic anemia patient. She says, we've tried talking to 2 different therapists who they don't feel was very helpful because they really didn't understand what aplastic anemia is. You mentioned that there were some resources available. What are those resources? And the other question is there some type of specific therapist maybe that they should be looking for when they're seeking someone for assistance?
Sure, I can answer that. Well, I think it's a conundrum that a lot of people experience, right? Because they don't necessarily want to be the one to always be educating their provider about what they're going through in order for that provider to then help them. But I think looking for somebody, the key is somebody with behavioral medicine experience. There are providers, therapists out there who specialize in behavioral medicine. Again, there's not tons of them. There's not tons of us, but that looking for behavioral medicine or looking within, and I'm not sure how wide of a net we're having here. Is everybody here seeking care at Roswell, or is it more broad than that?
This is an online question, so this is out in either U.S. or abroad.
Got it.
But we'll stick to U.S.
Thank you. In that case, I think trying to find if there is a comprehensive cancer center around, that would be the place that I would start, because usually the cancer centers have resources, and if not direct resources, they have local lists of providers that they've partnered with in the past. Also looking at through support groups and online resources that can often be, if there are local folks who are having similar diagnoses or struggling with similar things, I know that usually people can network within the context of support groups and whatnot to find providers as well. But I think probably my best advice would be to start with the regional treatment facility and then go from there.
Thank you. Any questions from the room? Okay, we'll go to our next one online. This individual is seeking some tips for dealing with their physician who they feel gives minimal information because there's always a line of patients scheduled after their appointment, and this is causing them extreme constant anxiety.
So it sounds like an experience where you end up getting through the visit and then feeling as though your questions aren't answered. I think that can happen for a variety of reasons. Obviously, when waits are long and you can get a sense of being sort of moved through quickly. I think the other thing that can happen is that in those visits, anxiety levels can be high. And I know this from personal experiences interacting with physicians, and you'd think that I would know better, but you get overwhelmed and it's a little bit deer in headlights, and then you're out the door and you realize that you didn't get the information you wanted. I think it can be helpful to come in prepared with a list of questions that you've written down. Even if you think you're going to remember them, the presence of the written questions does a couple things. It helps you remember them, for one thing. It also then allows an opportunity to interact with a physician around your questions. So you can say, I've brought in 3 questions to talk about today. Sometimes that can slow the visit down just a little bit, and allow you to get those questions answered, because it can organize the visit around the questions at hand. And that, I think, the final piece of advice with that is usually if you have a loved one that can come into the visit with you, that can also help as far as kind of broadening the visit just a little bit to make sure you get your questions answered.
Thank you. Any questions from the room? Sure.
Yeah, I got in trouble for telling my doctor that I Googled bone marrow sampling.
Yep.
And you just mentioned, how would you go about going online to find a support group? Where would you go?
The support group piece is tremendously challenging. And I honestly am not as well versed in the specific MDS resources for support groups. I would defer to people who are more expert than I.
I can help you with that afterwards, after the session. Happy to help. And you won't have to Google.
Yeah, it's tricky. I know that here at Roswell we have offered some support groups, and then some of them start and then they stop, and then there's COVID, and so the getting something that is consistently up and running is a tremendous challenge. And that we build them, and then sometimes there's a huge interest, sometimes not. But I would defer if you're looking for more sort of illness-specific resources. I would punt that one.
So first, our organization does offer support groups. They are virtual, and we will be launching also an online platform also, and I can help you with all of that, where to go and where to do that. But we do offer support groups throughout the month, and they're currently all virtual. And you can actually find them directly on our website, but I'll help you get that together. Yeah. Our next question is from a patient who says, I have an amazing support group, but it's support chaos. Everyone is trying to do everything, and I appreciate the help. How do I help them get more organized without hurting anyone's feelings?
That's an excellent question. So there are lots of people willing to help, but things are sort of all over the place as far as who's doing what and when. I think some of that depends. I guess, what advice would I give to her? I would say, is there a person in that group of organized chaos that has some organizational skills? Because it sounds like somebody needs to be a project manager. And oftentimes it's hard for that to be the patient, because the patient is trying to get through all the different pieces of treatment. But if there were a family member or a friend who has some prowess organizationally, I think that person could be tasked with maybe making a Google Doc of who does what when, or creating a calendar for rides to this or that, right? Everybody has a strength. And every now and then in your support network, you have somebody who is good at that. That would not be my role. But if you do have a friend that is willing to take that on, then the message for the group is, thank you so much. I appreciate this huge outpouring of love and support. We're going to work on a way of trying to organize that so that everybody can play a role, and we can we can streamline it a little bit.
Great. Any questions from in the room? Okay. Our next question is, I suffer from chemo brain, and sometimes it can be difficult when I'm trying to express how I'm feeling or to get thoughts out. Any advice on how I can let others know that this is what I'm suffering from? And sometimes it just takes me a little longer to get my thoughts out.
So it sounds like in the context of a conversation, he or she may need a minute, may need some time to organize thoughts. I think probably the most straightforward way, if there are people in your life that you speak to on a regular basis, right? This isn't just the passing acquaintance, but if there are people that you connect with that are in your closer circles, just saying things like, when I'm talking about how I'm feeling, I have a hard time getting it out, and sometimes what would be helpful is to just have a little bit of space to be able to do that. Letting your loved ones know what's helpful, I think that in and of itself is helpful. And chemo brain is something that people have such different experiences with, but being able to say, this is how it impacts me, and it makes my thoughts just a little harder to enunciate. The other thing that might be helpful is for the person to, and again, it's not a strategy for everybody, but a lot of people find trying to write their thoughts helpful, particularly if speaking your thoughts is not something that that comes easily. I know a lot of people who keep journals about, writing down what they feel, and then sometimes they choose to share that writing with their loved ones, sometimes not. But it gives you an opportunity to try to organize it a little bit and to get it out there. And then sometimes once you've done that, it can be easier to express it verbally.
Thank you. Any questions from in the room? Okay, we'll go to our next question online, which says, I have an amazing spouse who helps me do everything. However, I'd like to be able to put on my own shoes. Any advice on how I can talk with my spouse about letting me put on my own shoes and do some things for myself?
How to have a little bit more control. I have had many versions of this kind of thing. I really still can do XYZ thing, right? It probably starts with an expression of gratitude and appreciation, much like how this person has communicated her comment or his comment to us on this forum, right? It starts with, I have an amazing spouse. And to say, I so appreciate all that you're doing for me. I am personally working on some of my own goals, and one of them is to try to get a little bit of independence back. And so what I'm going to be trying to do is to take on, we don't know how it's going to go, but to take on some of these things which I haven't done and see how it goes. So how about tomorrow, I give it a go, and we'll see how it goes. And then from there, if you can phrase it not as, stop doing that, it's driving me crazy, and rather as, thank you so much. This is what I'm trying to do to try to get a little bit of, independence back. It would be helpful to let me do it even if I'm struggling, but I promise I'll let you know if I need help. Something like that, where it acknowledges the help, and the caregiver doesn't feel rejected or dismissed.
Thank you. Anyone else from the room currently? Okay. Next question from online is, I'm in a new relationship, and hopefully our relationship will continue. Thank you for mentioning about intimacy. I find it difficult to discuss my illness, and my illness does impact my willingness or my desire for intimacy. How have you helped people in the past with addressing this, especially since this is a new relationship?
It is really, really not an easy thing to do for most of us, because talking openly about sex and about intimacy is just not something that we in our culture generally feel comfortable doing. I think the best advice I have is to introduce the conversation. There's these appropriate times, right? You don't want to meet somebody on a first date and say, hi, my name is so-and-so, I have this diagnosis, therefore I have intimacy problems. You want to find the window where the timing is appropriate. And I think honestly just saying, this is something that isn't easy for me to talk about, but I think, I really care about you, and I'm very hopeful about our relationship, and so it's important to me, as hard as this is to talk about, to be honest with you about what my struggles are, and how we might together be able to sort of work through those. Because usually, if you can be, I guess the important pieces of that is open communication, honesty, and then an ability to be flexible. I mean, how do we work things out such that we can manage some of these intimacy problems? Sometimes it's trial and error. Sometimes this is just how it is going to be for the time being. Sometimes more permanent, right? But being open with each other and also being kind of creative and willing to be flexible and adapt, I think is a real big piece of that. And then I think there are, to just escalate it up one level, there are a variety of different therapists out there whose expertise is in the area of sexuality and intimacy. And I think if situations were such that those sort of lower tier interventions were not successful, then talking to somebody with some expertise about working through intimacy challenges could be helpful as well.
Thank you. Any other questions from the room? That's all the questions that we had online. Thank you so much for handling all of those wonderful questions from everyone. So thank you so much, Dr. Pailler, for sharing your time and your expertise with all of us today. If you'd like to watch this session again at a later time, it will be available on the conference platform within the next hour by accessing the session, clicking on replay, or just navigating the on-demand tab on our platform hub. If you have any additional questions, please send it to us at any time in 3 ways. Send it to help@aamds.org. Call our helpline at 800-747-2820, extension 2, or you can always submit your question to our Facebook page. If you're watching online, please do take a few minutes to complete the online survey. Your input is important to us and helps us with planning our future programs. This does conclude the educational sessions of our conference. We hope everybody will stay and join us for the support groups, which will be right after this session. And if you're participating online, please use the Zoom link that's provided on the homepage to join us on Zoom for the groups. On behalf of the Aplastic Anemia and MDS International Foundation, I'd like to thank you for joining us today, spending your time with us, making us your resource of choice for information on bone marrow failure diseases. Our medical advisory board and team are always here to support you and your family, as we've done for the past 39 years. And again, a big thanks to Dr. Elizabeth Griffith and the entire team at Laswell for having us and supporting us today and bringing some of the best experts to speak to everyone. So thank you again, Dr. Griffiths, for everything. Thank you so much, and everybody have a great day.